Oh, yeah, here you are.
Hello,
Hello.
Sabra.
Hi.
How are you?
I'm good. How are you?
We're
We're
doing well. We're
good.
doing
We're
well.
doing well. It's your first time doing a live
I
interview,
know
right?
it is. No at all.
No
No, no
pressure at
pressure.
all.
No, no, it's fun. And the Base Rates community, they love people and they love
Yes,
listening to people and tell their stories and their experiences.
absolutely.
But
Yeah,
yeah. Thank you so much for joining us and giving us your time.
yeah.
Well, to be here.
You are.
Good, good, good. So yeah, we briefly kind of mentioned about your work with nursing and helping people and,
Yeah,
and sort of navigating this COVID thing for the last 2 years almost.
yeah.
Can you kind of talk to us sort of, I don't know, how it
Um,
began in terms of like what inspired you to become a nurse and
yeah,
what was that journey like for you?
Woo, it's a long story.
Yeah.
that's okay. We're ready.
Well, I didn't know that I was going to work in healthcare ever. I've never thought about it
Mm,
until I came to the United States 10 years ago. And the first job I got was in healthcare. And the
mm,
more I did it, the more I loved doing it and wanted to do more. I was a nurse's assistant.
yeah.
So, what put a stamp on it was when my mom was sick, and I
Mm,
saw how much of a difference it makes when you have really good people taking care of you. So,
mm,
that's how I decided to join. And then I went to college, and I fell in love with nursing even more. You know, learning about the body, how it works, how to
Yeah.
heal it, all that was so interesting to me. So I decided to pursue it.
Yeah, I remember when you decided to pursue it, how excited you were, and and for me, I was like, oh my God, I don't take this wrong, but I was like, oh my God, I despise hospitals. I hate blood, and then all these things that I'm like going to the hospital. It's like depressing for me, and it just like for you to have been with your mom, seeing her experiences and the people that were taking care of you and inspiring you to do this.
Mhm.
I wonder if it sometimes it gets too much for you. It like brings
We
maybe
have our days, but mostly it's good.
mostly
Yeah.
it's good.
Yeah.
So how was it for you during during COVID? Because there was a lot of I feel like I don't know if this is true or not, but I feel like there was a lot more death in the hospitals than you guys have experienced. How was it? How was it for you? Because I know you traveled around the country and worked on those, you know, like you've seen it. We were hiding in the house,
Uh,
quarantining,
Yeah.
and you were just out there all the time, and I was worried. Yeah, how was it for you?
it was pretty scary. When it first started, we were converting all the floors into COVID units and
Mm,
had like a 4 hour crash course about how COVID works and how to take care of those people. We had no idea what to expect.
yeah.
And we were really afraid of the unknown,
Mm,
really. And we didn't have enough PPE,
mm,
mask and stuff,
yeah.
personal protective equipments.
Yeah.
Yes.
We had to reuse those so many times, and being afraid of going home and passing that COVID to your family members, that was even scarier.
Mm,
And then came treating people and the way the disease was progressing rapidly, and people, you would get a almost healthy patient at the beginning of your shift, and by the end of your shift they would die or even intubated on a ventilator. So it was pretty scary for us.
quickly.
Yeah.
It was
Yes.
really quickly.
Yeah.
Hmm.
And also like you mentioned the unknown, like in those early days, not to like relive, I guess there's a lot of trauma for a lot of people, but there was like seemingly new information like by the hour sometimes where you're like, we treat it this way, and okay, never mind, we have to treat it this way. I
Hmm.
feel like it was just a lot of just trying to keep up, trying to keep your head above water.
It was pretty hard.
Yeah.
I was thinking about, having you guys didn't have enough people. How did you say PPO?
PPE.
PPE.
Personal protective equipment.
Yeah, and you had to reuse it.
Yes.
Were you scared that you might get it because you're reusing the same
Absolutely.
masks?
Absolutely.
When you
Yeah.
were the most exposed.
We were most exposed, and it was very scary. You would get home and take off your clothes before you even enter the house, having to put all your stuff in the bag, taking a shower before greeting anyone because you really didn't know.
Oh wow. Yeah.
Yeah.
How is it now? Because it's slowing down. And how is
It's very much better. People are getting vaccinated. Cases are going down. Less people are being hospitalized. So you can see the difference absolutely after 2 years.
Yeah. That's really challenging.
It is.
It is. It's.
But it shows, and I'm sure people have told you this, but it takes a lot of strength and bravery to sort of get through. Like mentally, I can just only imagine how taxing that can be day after day.
Yeah.
Not knowing, the right way or the best way to get through this.
Mm-hmm.
But it's just like the amount of strength that it takes to just carry on and be like, we're going to do our best. And, we are one of the key peoples to sort of, remedy the situation and find a way out of it.
Yeah, absolutely. It was very, very scary. Why people were so afraid, first of all, and they would burn out because seeing a lot of people getting sick and dying in front of you and having to update their families through their phone because they couldn't even come and visit. That was even the hardest part because you would have to update the family throughout the shift if something worse than that. And what I decided when I first started during the pandemic was to decide to travel because that gave me a lot of time to in between assignments to kind of lean back and stay at home with my family and then gain more energy and then go back to it. That's what helped me during the pandemic.
I never thought about it because I knew you were traveling a lot on, working on different hospitals around the country. And I didn't realize you will have some time in between so that you can recover from the first assignment and then heal first and then go back. That's really smart because a lot of the times I saw, especially in the news, a lot of people first, in healthcare, they were really, really stressed. Like I feel like a lot of them ended up having a lot of anxiety, trauma from
and then a lot of people, according to the stories, a lot of people quit. And they couldn't take.
A lot of people quit.
Yeah.
There's a shortage of nurses everywhere.
Mm-hmm.
Yes.
Yeah.
Did
you feel like this is not what I signed up for when the peak of the pandemic and everything is just going crazy? Were you like, I did not expect
Of course, we had our days, but also you have to think about what if it was you in their place? You would want someone to take care of you.
Yeah.
That's what made us go back again and again because someone had to.
Someone had to. Yeah.
Even when the pandemic started, they kind of started limiting people to enter the rooms, which means if you were a nurse for that person, you would do everything, all the assessments, everything on that patient, so that no one else gets exposed. So that's how they did it, so that we can treat more people.
I'm so glad we're at least almost at the other side of this.
Yes, very much so.
Yeah.
Would you say that? I don't want to sound too
dark.
I don't know. Well, yeah, I guess dark, but like being so, I guess, involved and having seen far more than a lot of people. Do you feel like globally we feel like we're on the tail end of of this whole thing?
Do I feel like I'm on the
Well, like, yeah, like, do you feel like the world, like we're almost over COVID?
Yeah.
that I'm not sure because you never know, but
Yeah.
I do feel like it's a lot better than how
Very
it was
well.
even 2 months ago.
That's
So
true.
there is hope.
There is hope.
Yeah.
There is
Yeah.
hope. On the brighter side, what do you, apart from the COVID and the pandemic and all the dark things that has happened in the last few years, what do you love most about your work? What's like the most, some examples of times you were like, oh my God, I am so glad I am in this line of work.
There is so many things. The personal connections you make with people on your job,
Yeah.
the satisfaction, the feeling that you helped someone get comfortable, and going home that feeling like you made change, you know, someone's day, that's enough for you. But I can't say on the top of my head, but
Yes, okay. Do you remember like your favorite patient that this is just me thinking like you had this, they go home and you just have this, you know.
Every time. I can't count how many, but yeah, we get more good people than bad.
Yeah. I would hope so.
Yeah, I would hope so. Yeah.
Yeah.
That's also like, it's a big thing because in my experience of like going to the doctors, like a doctor's appointment, or even like the hospital for, I've broken a lot of bones in my life. It's for me, I was never like happy to be there.
Yes.
Because it was like, something's wrong with me, now I have to get it or get it fixed. And it's always kind of been underappreciated, I feel. Like the ability for a nurse or a doctor to sort of turn that person's day around.
Yeah.
Because they're immediately going into a situation they would prefer not to be in, but they leave it feeling hopeful. Yeah. And feeling better than they did going out or going into it. So yeah, that's a particular skill I feel that people in your field, and I'm sure you specifically.
Yeah, because I feel like if I go to the doctors, I'm grumpy.
Yeah.
I may come back not grumpy, but when I'm going there, I'm mostly people are scared. So you kind of meet them at their worst.
I know. Imagine you were sick and you met someone with attitude, a nurse with attitude, how you would feel. Even worse.
Oh, right, exactly.
Oh.
You might come out of that feeling, maybe even being sicker than you were, because like the stress then like starts to affect the body. And,
yeah, that's true.
So kudos to you and all of you
for staying positive throughout this, you know, hardship and helping people and, you know, the worst
job.
Yeah, it's a very fulfilling job I can imagine.
Yeah.
Oh yeah, very much.
Is there something that you wish you knew back then that you know now?
Yeah, I think so.
You do?
Well, there are many aspects of nursing. The one thing that I would say is that nursing school will never prepare you of how to deal with death. Every death is different.
Oh, yeah.
You have to learn while you do your job how to talk to family. How do you talk to someone who just lost their child or parent? Yeah. It's more than medical. You have to take care of the patient and the family as well. That definitely was the hardest part for me to kind of learn. Yeah. So having a very good memory, it's very crucial because when you're taking care of people, you have to know everything about them. Yes. If a doctor comes and talk to you about this certain patient, you have to be able to answer everything about the patient.
Oh,
Right.
I see. Yes.
Yes. Or even for God forbid, if you're taking care of the patient and they get worse, you have to call the doctors and all the staff to come and help you. And when they get there, you're the only person they're going to ask, what's wrong with the patient? Why were they there? What happened? And all that. That's something that you have to know. You can't just go back to the chart and look it up. That's something to know. Yeah. Definitely, memory is a big part of it.
Yeah. Oh, wow.
Yeah.
I'm now thinking like I'm gonna go back to COVID because so quickly, like a patient comes in, you have this idea of what they're going through, and then rapidly everything is changing, and you have so many like of them. I wonder for how many patients were you? I wonder how like for a per nurse how many patients you have a day and how much you have to memorize of those people's history and the conditions are changing like.
Yes. Well, you will have about 6 on average, but some might go home and you would get another patient. So it can vary between 6 and 8, usually.
Wow.
Yes.
Yeah, it's a lot.
Mm-hmm.
And then that's like 6 to 8 people whose like life details you have to know.
Life details that you have to know exactly. Yeah, there are so many things I thought that I wish I knew. That will mean, well, it's very challenging, which means it's physically challenging as well. So your body would hurt when you get home.
Yeah.
Yes, you would feel like someone has beaten you up.
Oh my God. Yes. Yeah.
Yeah, that was, yeah. And also your friends asking you for advices, medical advices all the time. I'm sure you have.
That's me.
Oh, that was you?
I do that to her all the time.
Everybody does. They think I know everything, which is not true. Yeah. And sometimes you might feel underpaid as well. Depending on the day you had, you would get
depending on the day.
Don't pay me enough for this.
Because you're caring for people, because you care for them and you know this patient, you may end up doing more than you get paid for because you care for them and you know what they need. So that's probably, it's a hard line of work. It makes me, it makes me appreciate you even more.
You have to love it to do it.
You have to what?
You have to love it to do it.
You have to, yes, absolutely.
At the end of the day, even if it's challenging, you love it.
Yeah.
You love your job,
So you never go home and be like, I don't think I'm quitting.
No, that hasn't happened to me. No.
So like
because the jobs you quit, you go home and like, what? I am done with this job. I'm quitting. Yeah.
It sounds like when you have a challenge, like at work, and obviously you're not going to quit. Do you see it as something like how like a puzzle almost that you can solve? Like what's the best way to tackle this issue or to overcome this whatever?
You are always critically challenged. So if something happens, it's exactly like a puzzle. You have to you take it as a learning opportunity for you.
Learning opportunity. It's not just like as static as a puzzle. Like there's human emotions involved as well. Which is very complex, and like you said, you have to know how to talk to people and how to empathize with people. Like this is not a line of work where you cannot be compassionate. Like you have to have
it goes with the job. Yes.
Yes. I'm so grateful that you do what you do, because we all need people like you, because there's a lot of our bodies that needs that we don't know. So it's always nice to know that there are people who are specialized, especially for, to help pretty much the most vulnerable, because our bodies can give up so easily. So we appreciate you.
No, I was gonna say, because we were talking this morning, Dean and I, about how, I'm not even sure how this pertains to the conversation, but it's just like you just said, the body can sort of, go through this and you're not necessarily aware of it.
Yeah.
Because I just realized I had an epiphany this last couple of days about how the mind, how like in stressful moments, your mind can sort of kind of trick your body into thinking that everything is all right. I can just continue forward. I may be feeling these things, but I can just sort of compartmentalize or whatever. But while your mind is telling you that everything is all right and you can continue being a soldier through all of this, your body is still feeling all of these sensations, like all the stress and all the trauma. So like it's important to, especially with you, like I'm very happy to hear that you take time for yourself, because it's a very high stress job at times.
Yes.
I'm happy to hear that you take time to like sort of feel your feelings and sort of get out all of the anxieties and whatever you may feel.
Yeah, absolutely.
Oh yeah, it's very easily to burn out as a healthcare worker in general. So you have to kind of learn how to cope with it. And also throughout the career, you kind of learn how to leave everything at the hospital when you get home. Because you cannot mix them up.
You cannot.
Yes. Otherwise, it will affect you on your daily life. You do that. Yeah.
Oh man, that's that, because I'm thinking, if you like had a really rough day, you see people passing and everything, and then you go home being able to shut it down. Even like watching news, especially in the last few years, when you watch news a lot, it really affects your mood. And it's news, and so I can imagine for you to be, there, seeing it with your own eyes, and then being able to shut it down when you go to bed. What are the techniques do you use?
You learn it throughout your work. Of course, when I first started in the healthcare field, that was hard, because sometimes even on my day off, I would request to go back to work so that I can take care of the patients that I left. And I realized that it was taking a toll on my daily life, and learn slowly how to compartmentalize work and daily life.
Wow.
Something that you learn with time.
With time. But you're definitely not told in school that you will need that.
Oh yeah. They will never. Even if they tell you, you can never tell you're there.
You don't really until you go through it.
That
makes sense.
Before we let other people ask questions, we have a few more questions to ask, but whoever's watching, you're welcome to ask Sabra any question you have. Not as a nurse, not like the way I do it.
Try not to ask her.
not ask her about your headache.
What's this? No, just general questions.
General questions. You're all welcome to join in. Somebody here asked to join, but we can let them in later. So we were wondering, what's your nugget of wisdom you may have for someone who's joining your line of work, or who's thinking of joining? When we were kids, some kids say, when I grow up, I want to be a nurse, or they're ready to be, to join this line of work. What would be your advice?
Nugget of wisdom when you get there: never be afraid to ask questions. Knowledge is always power. Get there and feel like you're stupid and you don't know anything, but it's always good to ask. Yes, definitely.
And I bet it's important to ask those questions as well. I was a quieter kid in class, so I was one of those people who were like, this is a dumb question, I'm not going to ask it. But there may have been like 3 or 4 people who had the same question. But in your line of work, the difference between knowing how to treat someone properly and not is asking those questions. So I bet that's very much encouraged.
Oh yeah, it's very much. I was very lucky. I got a really good preceptor when I started nursing, and she was a nurse as well. She was kind of teaching me when I first started, and that's the first thing that she told me. she was like, don't feel like there is any stupid question. If you want to ask, just go ahead and ask. And that helped me a lot. Even now that I'm experienced, I always ask. Because you're dealing with somebody's life in your hands. So you have to put your pride on the side and ask questions.
Yeah.
Yeah.
Right.
Yeah. You can never be scared in this line of work. Like chicken out, because I can.
No, you cannot. You cannot. Yeah. You have to always be willing to learn.
Yeah.
Right.
Yeah.
Wow. So that actually goes for any other area in life. Asking questions that's really crucial for anything we're doing, because at times we can forget that we don't know everything. And but we always don't know everything, and it's okay to not know everything. So that actually goes, for even for me in my line of work, or anyone who's watching, just ask questions.
Yeah. Stay curious.
Stay curious.
Exactly.
I like that. I like that.
You love traveling.
I do very much.
It's everywhere.
And despite the circumstances that may allow you to travel, in terms of like, you know, COVID, needing more nurses in different parts of the world, what have you learned about how different people operate within the medical field in different parts of the world? I know it's kind of a general question, but have you learned anything sort of surprising, or something that you would love to be able to incorporate in your day-to-day sort of workflow?
Well, when you travel, like around all the hospitals, it's pretty much the same, and the people you meet, but you do get different cases, and you're able to learn. I feel like ever since I started traveling, I learned a lot, because I'm under pressure that I have to know a lot of things, and that made me document myself and study even more, and it made me a better nurse.
Yeah, it did. Have you seen anything? There's something you mentioned about the healthcare systems in Europe. You weren't working there, but you experienced something that I found very interesting in there. The difference between, like, for example, like a Rwandan healthcare system, if you were able to see how the doctors and nurses work, or just the system itself, how much the medication is, the expenses, like, because going to the doctors here in America, it's expensive.
Very much. Yeah.
And you've seen other areas, like you were in Europe a month ago, and have you, like, when you ask questions to your friends or the people that work in the same line of work, are there things you're like, oh, if we adapted this, it would help?
Oh, so many. There is a huge difference about here and there, definitely. I wasn't able to talk to anyone who works in the healthcare field over there, but I talk to people who are there, and here we do know that if you are sick, you start thinking about how much you're going to be paying.
Yes. Right.
That's the first thing you think about.
That's the first thing you think about. You don't even think about yourself. But when I was there, I got a little sick. I had an ear infection, and I had to go to the doctor.
Yeah.
I had a friend of mine who we didn't even call her doctor. We showed up, and he was able to talk to me within like 15 minutes of me getting there, and did a lot of exams, wrote me some antibiotics, and I was on my way out.
Ear infections.
Yes, ear infection.
It would have cost your fortune here.
And also, you may have had to wait like two weeks, especially in Los Angeles. You might have to wait 2 or 3 weeks before you can get it.
Call an appointment. Calling my doctor, you have to call, you have to get an appointment, and that will take you probably 2 weeks, sometimes even more.
Yeah.
And you also have to worry about the costs. When I was there, I only paid 12 euros.
12 euros, which, like, that's about $12.
Yeah, that's yeah.
That's all I paid.
And you're a foreigner there too, like.
Yeah, that's right.
Yes, I'm a dinner there, and I
Yeah.
only paid 12 euros. That was eye-opening for me because
Yeah.
a different story. Even me and my husband last year when we did our yearly physical for labs, we paid, I think, $400, and we had insurance.
And you haven't. Oh,
That's
Yes.
that's gonna change. Like, yeah,
yeah. I mean,
yeah.
I don't want to harp too much.
I'm not
I don't want to
getting
like
into
get you in
politics.
trouble or anything like that. But
If we get to it, it's gonna be very,
yeah, yeah.
Yeah, we're gonna complain for days if we get
I'm
into
sure
it.
the audience, anybody who's listening,
Yeah.
has opinions as well. But
Yeah, yeah.
yeah, it's really interesting just the differences
Yeah.
in how they operate. I've
Yeah.
always been fascinated about that.
Yeah, same.
yeah, you kind of wish you were there. I kind of wished when I was there that I live there so that I don't have to worry about my health.
Yeah,
Yeah.
yeah.
Right.
Especially when you get older, you need more. And I've seen so many people at the hospital who were sick, and some of the medications were not covered by insurance, and they have to pay out of pocket, and they are retired, and that's very challenging. You know, it's sad to see when you work.
Was COVID part of the insurance? Because it was new, but was it like the medication?
Yeah, it is part of the insurance, but that just doesn't stop the bill when it comes. It's still high.
It is.
Yeah.
It is. It's still
Just stop the
high.
bill.
That's that's a lot of
Oh,
things to
man.
think about. Yeah.
Yeah.
So I'm
Yeah.
glad you're, sticking around and helping people and doing all the work that you're doing. Was it? I'm wondering if it's as you were speaking about how you stayed in, even like learned how to manage, travel and take time off and just take care of your mental health. I wonder if your background, just coming from Rwanda, being a genocide survivor, all the things you went through, kind of, I don't know, just give you like a thick skin on navigating these situations. Did it play a part? Because sometimes it's like a tool for me in my life. So I wonder if it's something also that kind of it becomes like a tool for you in the
Yeah, absolutely. Because, we both came here in this country. We were young and came by ourselves. So that by itself kind of paved the way. And now I'm not afraid to go anywhere new. I'm okay because I know that I'm going to learn throughout. And that's okay. Yeah, that helps me a lot in my travel.
Because same. It's not hard for me to move.
No, it's not hard. I've done it before. I can do it again.
Yeah.
It's a good. I think that's a healthy outlook, right? I mean,
yeah, absolutely.
Yeah. So you actually asked me what I need to add on. Well, there is a march here in America for people who are in America on the Washington statute to kind of, there is a peaceful protest for nurses they're fighting safe staff ratios and workplace violence against healthcare workers because they're most likely to get physically assaulted at work more than any other job in the US. There was also a federal data that showed that in 2018, like 73% of workplace violence, non-fatal workplace violence, happened in healthcare. So they're kind of doing a march, and they're trying to raise awareness about that. So if anyone is available to kind of join us, that will be nice.
That's wow. That's actually really important because you guys are with people like on a daily basis, and is the assaults from patients or the
physical or racial?
Because I know that a lot of you guys, especially here in America, Black nurses sometimes experience. I've seen people testimonies that going into a room to a patient, and the patient will say, "No, I don't want your Black face here," to
Oh
treat?
yeah, that has happened before.
Has it happened to you?
Oh yeah, absolutely. More than once.
More than once.
Yes.
And what do you do with that situation?
You just get someone else to take care of them.
Oh, yeah. I'm
Yeah.
sorry. Yeah.
Mhm.
Yeah. I'm sorry because you're there to help and the person doesn't want help because
Yeah, if they don't want help from you, you just don't help them and get someone else to help.
so you always have to have like a white nurse nearby to come and replace you.
Well, when they're not there, they get someone to come in. There was one incident actually that happened with me, and that certain patient wanted a white nurse, and there was no white nurses on the floor. We were all black or brown.
Yeah.
And the hospital had to call another nurse who was at home, and she came in and took care of him.
Wow. So can you report that?
You cannot.
You cannot report it.
That's
Oh.
why nurses are trying to raise awareness about that, because that supposedly comes with a job and it's not supposed to.
No.
Yeah.
It shouldn't come with
Yeah. It shouldn't come with a job.
Yeah, it's probably people never reported it before, or they reported it was never. That's horrible. I'm sorry.
Yeah,
I'm sorry that you go through that, and definitely people should be able to join if you're in DC. If you are
spread awareness.
East Coast, you can travel easily from New York to join and join in the solidarity. It doesn't
Exactly.
even if you're not a nurse, even if you're not in a medical field, but this is something that's a human problem now we have. And so thank you so much for sharing that information. Yeah.
Well, thank you for having me here.
we loved having you. You are a pro. Nobody would notice that it's your first time.
Oh well.
No, you did great.
Yeah, you did amazing. Yeah, it was a great conversation.
And I'm sure everybody who tuned in, I'm sure they learned something.
Yeah.
I mean, there may be other nurses or people in the medical field in the chat, but people will learn something from what you shared today. And thanks again for being so open and emotionally available and vulnerable with your experiences. So thank you so much.
Thank you so much, my friend.
Well, thank you.
All right.
Bye.